Return to play is much riskier than the return to learn process. The real bad, nasty things that happen with the concussion really seem to happen with that second blow to the brain before the initial blow has had a chance to completely heal.
So the reality of it is, if we're talking return to learn and we overdo it, realistically the worst thing that may happen is we may see an increase in symptoms. When we are talking about return to play, if we do too much too soon and put them at a great risk too early, we could be talking about catastrophic outcomes, because we're talking about potentially having a second injury before that first injury is healed.
Although thankfully the occurrence of full bleeds following multiple concussions is fairly rare, nevertheless it has been fully documented and realized in many individuals under the age of 25. Therefore, we have to be very careful about preventing that secondary injury.
When we look at concussion recovery and the return to play process, it really needs to be individualized. There's no one set cookbook approach for any of this. It's a different process for a volleyball player than it is a football player.
The return to play process is a gradual increase in activity, because we want to make sure that we're minimizing the opportunity for a repeat injury. It's imperative that the licensed healthcare professional understand why it is so important that we take this return to play process in a stepwise progression and really monitor and ensure that this is done in a supervised fashion.
Although there are not a lot of hard and fixed guidelines about how to return someone safely to play, and particularly contact sports, there are some international consensus guidelines that help determine best practices in this area. You as a healthcare provider can incorporate aspects of your assessment into determining whether perhaps that progression should take place even more slowly, perhaps staying at each step along the way for more than one day to fully assess whether symptoms are returning or whether any problems are occurring before they are in a very high-risk situation such as contact play.
Research is expanding on this subject, and we're learning more year by year, month by month. The recommendations in this course are really based on best practices as we know them now, and will likely change in the near future as we learn more.
So being careful about our progression and making sure that they have fully recovered before we put them into that type of high-risk situation is considered very important.
Return to play is really where the rubber meets the road in identifying when it's safe for these individuals to return to play and return to their activity levels that they were at prior to suffering the initial injury.